The hepatitis viruses are named hepatitis viruses because they predominantly infect the cells of the liver, causing hepatic inflammation, otherwise known as hepatitis. With that being said, these viruses also impact human systems outside of the liver. In fact, hepatitis B and C both can harm other organ systems, including the blood cells, the kidney, the blood vessels, the skin, and even parts of our endocrine system. It is important to consider how that these viruses not only cause severe liver disease, but they can also cause your patients to be sick in other ways. Now, admittedly, this section is going to be sheer memorization for you. And I will say that it isn't the most high yield of sections, but it could get you an extra few points on test day. And it is just cool to learn about. So first, let's start with hepatitis B. Remember, hepatitis B is the one and only DNA hepatitis virus. It is a hepatinovirus that is transmitted parenterally, sexually, and perinatally. It usually results in full resolution of symptoms, but it may progress to cancer, although it's not as common as hepatitis C virus does. The virus can cause several extrahepatic manifestations, or manifestations that are outside of the liver. Specifically, it can cause an aplastic anemia, affecting the hematologic system. And this is a disease or syndrome where the bone marrow essentially shuts down the factory and stops producing erythrocytes, so we see anemia. It is also associated with glomerulonephritis, particularly membranous glomerulonephritis, although it can progress to membranoproliferative glomerulonephritis, but that distinction is not important, and I would not spend a whole lot of time really focusing on that distinction. Just remember that hepatitis B virus can be associated with glomerulonephritic disease, which is really signified by hematuria. Finally, hepatitis B virus has a fairly close association with what is called polyarteritis nodosa. So take a moment to think back to our hematology discussions. What is polyarteritis nodosa? Polyarteritis nodosa is a systemic vasculitis of small and medium-sized vessels. It affects most all visceral vessels, or vessels going to visceral organs, but importantly, it spares the lung. That is an important characteristic of polyarteritis nodosa. So why does it have this close association with hepatitis B? What is the big deal about hepatitis B and polyarteritis nodosa? Well, if you remember back to our vascular section, 30% of patients with polyarteritis nodosa have chronic hepatitis B. And if you look at the pathology of these affected vessels, there are actually deposits containing hepatitis B surface antigen and our antibodies complexed together. So inside or on the vessel wall of affected polyarteritis nodosa vessels, we see deposits of this hepatitis B surface antigen and surface antibody complexed and smashed up into the wall. This indicates that this disease is possibly an immune complex mediated disease that is associated with hepatitis B. Now, unfortunately, hepatitis C virus has a few more extrahepatic manifestations that we have to remember. Hepatitis C is a risk factor for several hematologic manifestations that I've listed here, including essential mixed cryoglobulinemia, non-Hodgkin lymphoma, immune thrombocytic purpura, autoimmune hemolytic anemia. These are the hematologic complications associated with hepatitis C. Most importantly, I will point out that essential mixed cryoglobulinemia is an immune complex mediated disease that is strongly associated with hepatitis C. This is the disease where there's a vasculitis of small and medium-sized blood vessels that are caused by deposition of antigen, cryoglobulin, and complement into vessel walls. This is the most common extrahepatic manifestation associated with hepatitis C. I do not want to spend too much time focused on these here, as they are reviewed in more detail in other parts of the lecture series, but I just want you to be familiar with these names and associations. Hepatitis C virus is also a risk factor for membranoproliferative glomerulonephritis as well as leukocytoclastic vasculitis. It is also a risk factor for some dermatologic and endocrine diseases, particularly porphyria cutanea tarda, which is a subset of porphyrias or enzyme deficiencies in protoporphyrin synthesis. The pathologic link is not well defined, so we're not going to go too much into detail here, but just remember that it is associated. More importantly, and clinically relevant and possibly more high yield to the boards, is to remember that hepatitis C virus is also associated with an increased risk for diabetes as well as autoimmune hypothyroidism. So you can see that between hepatitis B and C, there are lots of autoimmune or immune complex mediated extrahepatic manifestations that cause all these sorts of diseases and syndromes that affect our patients that have been infected by hepatitis B and C virus. Now time for a flash quiz. What hepatitis B antigen is significant for high transmissibility of the virus? That would be hepatitis B E antigen. Remember, the E antigen stands for excited hepatitis virus. It is excited and is highly replicating and therefore is highly infectious.